Andrew, always great to speak to you, especially on a big week where AstraZeneca had to halt temporarily its trial because of a sick patient. Does this usually happen? Is it very common? Is this science working the right way?
Yeah, in these phase 3 trials that are particularly much larger than any previous clinical trials that have been performed, you always want to look for these rare events. And they're designed to capture these events and study them and then make a connection and try to see if the event is related to the vaccine or something that just happened to have happened coincidentally. And so I think this is a great example of, number one, why you do clinical trials, phase 3 clinical trials. The large number of patients allow you to capture some of these rare events. And I think the pause is perfectly reasonable, and it's something that happens often in phase 3 clinical trials because you don't want to keep going if you see an odd event happen. And in this case, it was a serious side effect. I'm sure the company is now in the middle of investigating whether it's connected to the vaccination or whether it's something that just happens in parallel to what was going on, and then we'll hear a report and hopefully resume that study in the near future. But this is science working. This is the way things are supposed to go forward.
Andrew, talk to me also about this very interesting study on the effect of COVID-19 on children. What have we actually learned this week?
Yeah, so, the role of children in terms of spreading the disease and also how severe the disease in children has been a real focus lately. Over the past couple of months, we've seen a very large spike in the number of cases of COVID-19 in children. Overall, it seems like when compared to particularly the elderly, there isn't as much severe disease when kids are infected with the SARS-CoV-2, the virus that causes COVID-19. However, there was at least one report this week that shows that when children get COVID-19, it's as serious as influenza is in that population, meaning that you still get a certain amount of kids that are hospitalized and have to go into intensive care. So it's another reminder that we shouldn't think of COVID-19 in children as a benign disease, as something that doesn't really matter. It's actually a serious disease in children. It may not be as serious as it is in the elderly, but it is something to be wary of.
As many kids went back to school or back to university, are these universities and schools doing a good job in, tracing and identifying a case and isolating it?
Yeah, I think you're seeing many, particularly, I guess, in the U.S., universities that are putting a pause on their plans to bring students back to campus. I think that, number one, it's compliance with social distancing that needs to be at the forefront. You're also seeing testing and contact tracing probably not being at the level that's needed in order to deal with such a large influx of students to the same campus. I think the other thing, too, is that the plans for shutting down these schools or going to online learning are also unclear at times. Several schools have sent their students home, even though some of them may be infected with COVID-19. That's not really the type of public health policy that you want, because that simply may spread the infection back to these students' home communities. So it's clear that some schools are doing a good job, but we need to really focus our efforts to upgrade and make sure that there's a more consistent policy across the colleges to deal with COVID-19.